4. Aneurysm. An aneurysm is a bulging or ballooning of a blood vessel wall, typically an artery, due to a weakening or thinning of the vessel wall. Aneurysms can develop in various parts of the body, but the most common types are cerebral, brain, aneurysms and aortic aneurysms, which occur in the aorta, the main artery that carries blood from the heart to the rest of the body. Aneurysms can be a serious medical condition because they can rupture, leading to life-threatening bleeding. Here are some key points about aneurysms. Types of aneurysms. Cerebral aneurysms, these occur in the blood vessels of the brain and are often referred to as brain aneurysms. They can be small and asymptomatic or larger and more at risk of rupturing, causing a potentially life-threatening condition called a subarachnoid hemorrhage. Aortic aneurysm. Aortic aneurysms can develop in the aorta, which is the largest artery in the body. There are two main types. Abdominal aortic aneurysm, AAA. These occur in the abdominal portion of the aorta and are often associated with atherosclerosis, hardening of the arteries. Thoracic aortic aneurysm. These occur in the chest portion of the aorta and can involve the ascending or descending aorta. Causes. Aneurysms can result from a combination of genetic, environmental, and lifestyle factors. Some of the common causes and risk factors include family history of aneurysms, high blood pressure, hypertension, smoking, atherosclerosis, buildup of plaque in the arteries, connective tissue disorders, such as Marfan syndrome and Ehlers-Danlos syndrome, trauma or injury to blood vessels, infections or inflammation of blood vessel walls. Who are at high risk for aneurysm? It's important to note that aneurysms can occur in anyone, but the following groups of people are generally considered to be at increased risk. Family history. Individuals with a family history of aneurysms, especially first-degree relatives, parents, siblings, or children, who have had aneurysms, are at a higher risk. Genetic factors can play a significant role in aneurysm development. Age. The risk of aneurysm increases with age. Aneurysms are more common in older adults, especially those over the age of 50. Gender. Men are more likely to develop abdominal aortic aneurysms, AAAs, than women. However, women tend to have a higher risk of cerebral aneurysms, particularly after menopause. Tobacco use. Smoking is a significant risk factor for aneurysms, particularly AAAs. Smoking can weaken blood vessel walls and increase the risk of aneurysm formation and rupture. Hypertension, high blood pressure. Uncontrolled high blood pressure can damage blood vessel walls and increase the risk of aneurysms in various parts of the body, including the brain and aorta. Atherosclerosis. Atherosclerosis is the buildup of plaque in the arteries, which can weaken and damage blood vessel walls, potentially leading to aneurysms. Genetic disorders. Some genetic conditions, such as Marfan syndrome, Ehlers-Danlos syndrome, and familial thoracic aortic aneurysm, can predispose individuals to aneurysms due to abnormalities in connective tissue. Injury or trauma. Trauma, such as car accidents or falls, can lead to aneurysms, particularly in the brain or arteries near the site of injury. Infection and inflammation. Infections and inflammatory conditions that affect blood vessels can increase the risk of aneurysm formation. Cocaine or amphetamine use. The use of certain illicit drugs, such as cocaine and amphetamines, can raise blood pressure and contribute to the development of aneurysms. Illicit drug injection. Injecting drugs intravenously with unsterile equipment can introduce infections into the bloodstream, which may lead to infected arterial aneurysms. Pregnancy. Some women may be at risk of developing pregnancy-related aneurysms, especially in the cerebral arteries. Symptoms. Small aneurysms may not cause any symptoms and are often discovered incidentally during medical tests for other conditions. Larger aneurysms or those at risk of rupture may cause symptoms such as pain, pulsations, or pressure in the affected area. Cerebral aneurysms may cause neurological symptoms if they press on surrounding brain tissue. Rupture. Aneurysm rupture is a medical emergency and can lead to severe internal bleeding. The symptoms of a ruptured aneurysm often include sudden, severe headache, nausea, vomiting, loss of consciousness, and neck stiffness, in the case of cerebral aneurysms. Treatment. The management of aneurysms depends on several factors, including their size, location, and the patient's overall health. Treatment options may include monitoring. Small, stable aneurysms may be monitored regularly to track their size and progression. Surgery. Surgical procedures can be performed to repair or remove the aneurysm. This may involve open surgery or minimally invasive endovascular procedures, such as stent placement or coiling. Medications. Medications may be prescribed to manage blood pressure or reduce the risk of aneurysm rupture. 5. Embolism. An embolism refers to the sudden blockage of a blood vessel by an embolus, which is a foreign substance or object that travels through the bloodstream and becomes lodged in a smaller blood vessel, blocking blood flow. This blockage can have serious consequences depending on where it occurs and the size of the embolus. There are several types of embolisms, with the most common being thromboembolism. This type of embolism occurs when a blood clot, known as a thrombus, forms in one part of the circulatory system, usually in a deep vein, and then breaks loose, traveling through the bloodstream until it becomes lodged in a narrower blood vessel. Deep vein thrombosis, DVT, can lead to thromboembolism, with the clot typically traveling to the lungs, causing a pulmonary embolism, PE. Pulmonary embolism, PE. A pulmonary embolism occurs when an embolus, usually a blood clot, travels to the pulmonary arteries in the lungs and blocks blood flow. This condition can be life-threatening, causing symptoms such as chest pain, shortness of breath, and even cardiac arrest. Cerebral embolism. In this case, an embolus travels to the brain and blocks a blood vessel, potentially causing a stroke. Cerebral embolisms are often associated with conditions like atrial fibrillation, a heart rhythm disorder, or carotid artery disease. Peripheral embolism. This type of embolism occurs when an embolus blocks a blood vessel in the limbs, usually the arms or legs. Peripheral embolisms can cause tissue damage and are often associated with conditions like peripheral artery disease, PAD. Systemic embolism. A systemic embolism occurs when an embolus travels to other parts of the body, potentially affecting organs like the kidneys, spleen, or intestines. Common causes of embolisms. Deep vein thrombosis, DVT, blood clots in the deep veins, often in the legs. Atrial fibrillation, an irregular heart rhythm that can lead to the formation of blood clots in the heart. Atherosclerosis, the buildup of plaque in arteries, which can create embolus-causing debris. Infection. Infected material can travel through the bloodstream and cause an embolism. Tumors. Pieces of tumor tissue can break off and become emboli. Fat embolism. This occurs when fat droplets from a broken bone enter the bloodstream. Air embolism. This can happen when air bubbles enter the bloodstream through wounds or medical procedures. Symptoms of embolism. The symptoms of an embolism can vary depending on its location. Common symptoms may include sudden chest pain, shortness of breath, confusion, paralysis, if it affects the brain, severe limb pain or numbness, if it affects the limbs, and organ dysfunction, if it affects internal organs. Treatment. The treatment of embolisms depends on the type, location, and severity of the embolism. It may include anticoagulant medications to prevent further clot formation, thrombolytic therapy to dissolve clots, surgical procedures to remove the embolus, or interventions to prevent future embolisms. Immediate medical attention is crucial when an embolism is suspected, especially for conditions like pulmonary embolism and stroke, which can be life-threatening. Air embolism. An air embolism, also known as a gas embolism, refers to the presence of air or gas bubbles in the bloodstream. When these bubbles block blood vessels, they can disrupt blood flow, potentially leading to serious health complications, including death. Air embolisms can occur in various situations and can affect different parts of the body. Here are some key points to understand about air embolisms. Causes. Medical procedures. Air embolisms can occur during medical procedures that involve the insertion or removal of catheters, needles, or tubes into blood vessels or body cavities. For example, they can occur during central venous catheter placement, dialysis, or certain surgical procedures. Trauma. Trauma to the chest or neck can cause a tear in the blood vessels, allowing air to enter the bloodstream. This can occur as a result of accidents, injuries, or certain medical procedures. Scuba diving. Scuba divers are at risk of developing decompression sickness, commonly known as the bends. This condition can occur when ascending too quickly from deep dives, causing nitrogen gas bubbles to form in the bloodstream. Lung injuries. In cases of lung injury, such as a punctured lung, pneumothorax, or lung surgery, air can enter the bloodstream and cause an air embolism. Symptoms: the symptoms of an air embolism can vary depending on the size and location of the embolus. Common symptoms may include sudden onset of difficulty breathing, chest pain, rapid heart rate, cyanosis, bluish skin color, confusion or altered mental state, dizziness or fainting. Stroke-like symptoms if the embolism affects the brain, such as weakness or paralysis on one side of the body, slurred speech, or loss of consciousness. Treatment: the treatment of an air embolism is typically aimed at preventing further air entry, supporting vital functions, and addressing symptoms. Treatment options may include administering 100% oxygen. High-flow oxygen therapy can help remove nitrogen bubbles from the bloodstream and increase oxygen delivery to tissues. Positioning: patients may be placed in specific positions to help prevent further air entry into the circulation. Hyperbaric oxygen therapy: in some cases, hyperbaric oxygen therapy, which involves breathing 100% oxygen in a pressurized chamber, may be used to accelerate the removal of gas bubbles. Surgical intervention: in severe cases, surgery may be required to remove gas bubbles or repair damaged blood vessels. 2. Fat embolism. A fat embolism occurs when fat globules or droplets are released into the bloodstream and travel to various parts of the body, where they can block blood vessels. Fat embolisms most commonly originate from the bone marrow or long bones, such as the femur, thigh bone, and can occur after certain traumatic events, particularly fractures or surgeries involving these bones. Fat embolisms can lead to a condition called fat embolism syndrome, FES, which can be life-threatening if not promptly recognized and treated. Here are key points to understand about fat embolism and fat embolism syndrome. Causes: fractures. The most common cause of fat embolism is long bone fractures, such as femur or tibia fractures. When a bone breaks, fat from the bone marrow can enter the bloodstream. Orthopedic procedures. Fat embolism can occur after orthopedic surgeries, particularly those involving the manipulation or intramedullary nailing of long bones. Trauma. Severe trauma, such as crush injuries or multiple fractures, can increase the risk of fat embolism. Symptoms of fat embolism syndrome, FES. Symptoms of fat embolism syndrome typically develop within 12 to 72 hours after the initial injury or surgery. FES can involve a range of symptoms, including respiratory symptoms, shortness of breath, rapid breathing, and low oxygen levels. Neurological symptoms, confusion, restlessness, agitation, and altered mental status. Dermatological symptoms, petechiae, tiny red or purple spots on the skin, often found on the upper body and neck. Systemic symptoms, fever, rapid heart rate, and low blood pressure. Gastrointestinal symptoms, nausea and vomiting. Treatment. The treatment of fat embolism and FES is aimed at stabilizing the patient and addressing symptoms. Treatment measures may include supportive care, providing oxygen therapy to maintain adequate oxygen levels and respiratory support if needed. Fluids, administering intravenous fluids to maintain blood pressure and hydration. Corticosteroids. Some patients may receive corticosteroid medications to help reduce inflammation and the body's immune response. Monitoring. Continuous monitoring of vital signs and oxygen levels is essential. Surgery. In severe cases where there is a significant compromise of blood flow or organ function, surgery may be required to remove fat emboli or relieve pressure.